Do you have Scheuermann's kyphosis and or scoliosis and you've decided that surgery is the right treatment option for you? Well, then this video is made for you. I'm going to answer some common questions about what it's like to have a long spinal fusion. So let's get started. Welcome to Happiness and Health Gains. My name's Hannah, and today is installment 2 in my series about Scheuermann's kyphosis and long spinal fusions. I didn't dedicate this series to scoliosis, but if you have scoliosis, then please consider watching some of these videos. I do have scoliosis, but it's not something that I really identify myself with because it was so mild in comparison to my kyphosis. And so it's not something that I really ever tell people that I have scoliosis, even though I do. And so if you have scoliosis and you're looking for information, you're looking for people to connect with and learn more about what really invasive back surgery is like, then I would consider checking out the rest of the series. Before I get into these common questions, I do want to give a shout out to my friend Marion. She gave some input on what her surgery and recovery was like, and so I am super grateful to her for that. I didn't want to just have this video be purely my experience. I think that the more information that you can get when you're going into something as huge as this kind of surgery, I think it's really helpful. Now let's get into some common questions about long spinal fusions. What is the hardware for a long spinal fusion like? The hardware for this kind of surgery is typically 2 rods and a bunch of screws. I have 2 rods and 26 screws, but I've seen other people's x-rays and they have less screws than that, so it really just depends. I am also fused from T1 to L2, and not everyone is going to have the same length as far as vertebrae that are fused, so that's going to change from person to person. How painful is recovery? If you watched my video last week about common questions for Scheuermann's kyphosis, which I will link right here in case you haven't, then you might remember that I talked about pain and how different people are going to be affected by it. Well, this question is very much similar to that in that it really just depends on the person. I wish that there was some way to say, like, are you going to have pain, or like who is going to have pain, because it would be really nice to know that, although it might scare some people off. So maybe it's good if you don't know if you're going to have pain or not. But this really depends. Marion, she told me that she really didn't have that much pain. She said she couldn't really remember having a lot of pain in her back, but she had pain in her chest and rib area because, as you can imagine, you're getting your spine straightened out. All of this stuff that has been kind of like hunched over and not had like room, it's getting all this room. And so it hurts to have it stretched out. So for her, that was where she had a lot of her pain. I had a lot of pain in my back, and I don't want to scare anyone off who is already fearful about that. It's not a fun thing to go through, the surgery, but it didn't last forever, and I'm way better off now. So try to keep that in mind if you are feeling fear about going through and whatever kind of pain you're going to have to deal with. How long is recovery? Well, this answer too is kind of varied. It's really going to depend on the person and how they heal and all of that stuff. For me, I was in the hospital for 7 days. I ended up having some complications. My recovery was about a month of pretty difficult recovery, and then 6 months, I feel like my life really started to get back to normal and I could do more things. Marion said that her recovery was 5 days in the hospital, and by the 2nd day she was up and walking around. After about 2 weeks, things started getting better for her and she was able to start getting herself off of the pain medications. What happens during surgery? I'm not going to go too in depth into what the surgery is like because I'm not a medical doctor or a surgeon and I don't want to be giving people the wrong idea, but I will tell you about what happened with my back surgery as far as I have been told. But still, go out and search for like more information if this is something that you're really interested in learning about. I think it's fascinating, but I know that a lot of people get creeped out by the thought of what goes on back there. But if you are like me and you think it's cool to learn about, then definitely go and do some research. As far as I have been told, what they did with my back is they cut it open, spread the skin open, and so you could see the spine. They shaved off some of the ends of my vertebrae. Then they take the metal rods and they actually form it to the shape of your spine as they're doing the surgery. and then they put in the screws and they sew you back up. Now again, I am not an expert on this, so please go and do your own research on this. What does the spinal fusion hardware feel like? Again, varied. I'm just gonna start saying that, and then this video would be like a minute long. But varied. Marianne, she mentioned that she doesn't really notice her fusion. She notices it if she moves her head weird. If you think about it, you have these rods in your spine, and so you don't really have to worry about that section of your spine, but above it and below it, it's not really protected in the same way, and so it's going to have wear and tear in different ways. For me, I do notice my hardware. I definitely notice one of the screws in my lower back. I get some localized pain, but overall, I would say that I don't really feel my hardware too much either. One thing that we both noted that we have in common, though, is that we have this weird numbness sensation around like the bra strap area on your back. And it's really strange. We're not sure if it's super common with people who have this. So if you do have this surgery and you have that sensation too, please put a comment. The other thing that I have noticed with my back, and it's gotten better since I've done massage, but if I have anything against my back, like if I'm laying on the ground and there's any kind of friction, that is super painful for me, and it will feel like the worst rug burn that you could ever imagine. So there are certain like nerve things that you might deal with, but I wouldn't say that you're necessarily going to feel too much with actually feeling the hardware. Can I live a normal life after a spinal fusion? The answer to this is really going to be dependent on the person. Some people are going to have more or less complications than others. And so I don't want to say that, yes, every person who gets this fusion is going to have a super normal life and that you're only going to have positives from it and there's nothing that's going to have to change in your life, because that would be a lie. But I would say that for myself, I feel like I have had the opportunity in a lot of ways to live a more normal life. With my self-esteem, it is so much better than it ever was before. And, you know, I do have some things that I just can't do. Like I can't twist. I can't lift a ton of weight. I can't lift weight if I'm pulling it like away from my body. That's just wouldn't be good for my back. And so there are certainly things that I can't do. But overall, I'm really grateful that I had the surgery. Marianne, she also noted that she was really happy that she had the surgery. And, you know, she went through a bullying period in her life. And so that was one reason that she decided to get the surgery. Her self-confidence really improved afterwards. I would definitely say that, you know, your life, expect it to change in a lot of ways, but expect many of those things to be good. If you are struggling with like the emotional side of things, then I would definitely expect that that's going to improve. Those are some common questions about long spinal fusions. In my next video, I'll be talking about emotional turmoils of living with Scheuermann's kyphosis. So make sure and subscribe if you haven't already. Click that little bell so that you don't miss any more videos in the series or from the channel. And as always, have a happy, healthy, and wonderful day.